Welcome, everybody, to Revive Health's Daily Briefing Live for Tuesday, May 12th, 2020. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators who are dealing with the COVID-19 crisis. I'm Chris Bevelo, Health Systems Practice Lead at Revive Health, and your host for the show. I'm joined by Chase Kleckner, who is Senior Marketing Manager at Revive Health and our show's producer. Hello, Chase.
Hey, Chris, good to see you again.
You as well. And we welcome back Chris Wickline, who is a strategist here at Revive Health. Chris has been on the show before, so thanks for joining us again, Chris.
Great. Thanks for having me, Chris and Chase.
Yes, we're going to have a great conversation today as we talk about some of the challenges for hospitals and health systems reopening. So looking forward to diving in. We will cover that in depth. Also, a couple other news points related to COVID-19. We'll point out a couple of resources. We want this to be an interactive experience for you. So if you have a question for Chris or myself or Chase, just put that in the Q&A queue down at the bottom of your Zoom window. You can also use the chat function in Zoom if you want to talk to other attendees, or if you want to follow along some of the links and resources we're going to be citing. Chase will put those in the chat function. We have a lot of them today, so good place for you to check out kind of the stories we're going to be referencing. Remember, you can subscribe to this podcast on iTunes. Search for Revive Health Daily Briefing Live. And as usual, we will be posting a video recording of this episode on our website by the end of the afternoon. Go to thinkrevivehealth.com/COVID-19. Couple of other quick notes. We are not experts on COVID-19, so this is not a place to come for medical or scientific advice or resources, but we do have opinions and advice for you. Just make sure that you keep that relevant to your specific situation. As we know, everybody's dealing with this differently depending on your organization, where you live, the market you serve, all of that. So with all of all that out of the way, I'm going to talk about my cough here in a little bit. I have a personal anecdote I will share. But first, let's get to some news. We always start with the case count and death count as tracked by Johns Hopkins on their tool. We do that to try to keep just an umbrella kind of reference point for all the things we're talking about. Obviously, we're hoping to see this first wave plateauing. I think some of the data that we've seen shows daily cases starting to drop a little bit, particularly when you include the New York data. If you take that out, it looks a little sketchier. And certainly certain markets are seeing continued increases, like where I live in the Twin Cities in Minnesota. Some of that, though, is related to aggressive testing. We're becoming much more aggressive with testing in our state anyway. So that's going to lead to more cases, obviously. So when we look at the Johns Hopkins tool, we are now up to 4,222,968 cases globally, 287,809 deaths. When we look at the United States, we are at 1,354,504 cases, and we are at 81,076 deaths. So possible by the end of this week, we hit that 90,000 mark. It really depends. We've seen daily death counts now dropping closer to 1,000, 1,500 a day. So if those spike back up, we might get closer to 90. We'll just have to wait and see. Oh, my cough is worse than ever. It knows I'm going to talk about it. It's acting up. So we're still not seeing the numbers we want to see. But hopefully things are turning a corner slowly but surely. We also wanted to share a Modern Healthcare article that came out yesterday as just kind of table setting for our conversation today. And really, there's a couple of highlights from it. The headline reads, "Deferred procedures drain hospital revenue by $60 billion a month." So this is a story that includes a lot of statistics, including that 55% fewer Americans sought hospital care over the past 2 months. And that is where they get the $60.1 billion average monthly revenue loss across all U.S. hospitals. So this is a report that was put out by Strata Decision Technology, looking at more than 2 million visits from over 228 hospitals. So, Chris, a lot in this story and the data behind it. You had mentioned before we got on the show some of the service line numbers were pretty startling as well.
Yeah, I would say, Chris, it's a very interesting article. The underlying research, which I think the article also links to, is fascinating, looking at the activity at the individual service line level and decreases from last year. You're seeing things like ophthalmology down 81%, think of cataract surgeries and the like, orthopedics down 74% over 2019. So it's, we feel it, we see it, but when you see the numbers, actually, I was going to say in black and white, but they're not. They're in black and red, maybe. It's stark.
Yeah, and we've been. This is not news, obviously. That idea that hospitals and health systems are losing a ton of money. But to your point, I think that this particular story and that cumulative amount was pretty staggering. One more point I want to kind of point to that just supports this. Again, it's not news that hospitals and health systems are losing money, but one of the consultants that we have a lot of respect for is Paul Keckley. He puts out the Keckley report. He had one yesterday, and one of the points he made in there was, we're thinking about hospitals and health systems having lost so much revenue because of the focus on COVID and closing elective procedures, which we know many of them are essential. He's making his latest newsletter the point that this is going to be an ongoing financial pain because so much of our health system in the United States, hospitals and health systems specifically, rely on employer-sponsored health insurance to pay the bills. So we're going to talk a little bit more at the end of this about payer mix, but for hospitals and health systems to remain financially solvent, they have to have a certain level of commercially insured patients. They can't rely on Medicare, where they actually lose money, even though some claim to make money on Medicare. If you listen to another consultant, Nate Kaufman, he will argue that actually there's some statistical things in there that say they're not even making money, and certainly on Medicaid or self-pay. So they need that commercial pay. And he's pointing out, obviously, the huge loss of jobs and the conversation that unemployment, even though the official number is at 14.8, even the official report that came out Thursday notes that there's a lot missing from that, and that conversations are it's likely more in the 20 to 25% range. So if that's true, then you can extrapolate how many of those people have lost their health insurance in terms of employer-sponsored health insurance, will have to go to Medicaid, will have to be self-pay. And that's just going to be continually devastating to financial bottom line for these hospitals and health systems. So it's why it's so important that they're able to get back on their feet in terms of opening back up to these elective procedures. But as we're seeing, and the point of today's show is really the struggle that hospitals and health systems are having to get back up to speed. We've been talking about this period as rapid recovery, labeling that because there's an urgent need to try to get back on your feet as quickly as possible financially to make up for the losses that we've encountered, to prepare ourselves for potentially a second wave where we might have to shut back down again. But what we're seeing is while there's a need for rapid recovery, things aren't happening as rapidly as we like. So Chris and I are going to dive into this a little bit, talk about some of those challenges and what the implications could be for marketers and communicators. And Chris, the first one really is the challenges that maybe a lot of folks didn't consider until they sat down and started planning to reopen from an operational standpoint. Let's talk about some of those first.
Sure. So I think, the first thing is just the sheer size and scope of the organizational effort. I think it's funny to consider the fact that hospitals are pretty well oiled from a process machine in terms of delivering care. And when we shut everything down, it created kind of a whole new thing that we'd never dealt with before is how do we start this all back up? So it starts with planning across the hospital, planning across service lines, across the system, things we've talked about before, staffing, OR space, and priority. But, that's just really kind of the tip of the iceberg. I mean, that's just the sheer project organization around that is probably the first hurdle that we're seeing.
Yeah, the story I wanted to share is I've been pretty open about folks can't help but notice my cough. This cough has been with me now for in 2 days it'll be exactly 3 months. It came with the flu, not COVID, back in February. And I've been to urgent care. I've done virtual visits. They've tried different things. Nothing's really worked. So it stuck with me. So last week I'm like, all right, it's been 3 months. I'm going to call in. And because I have this little tightness in my chest and cough, of course, now that makes me a candidate for COVID testing. So I had that done Wednesday night of last week. Still do not have the results for that. But my doctor also wanted to rule out some significant things, right? So he wanted to do a CT scan. And so yesterday I went to a hospital in the Twin Cities. I won't name it. It's it belongs to one of the major systems in the Twin Cities. It's one of the probably top 5 or 6 hospitals in the Twin Cities in terms of size, reputation, all of that. But it's also the COVID designated hospital for this system. And I had to go there because I hadn't got my test results back, even though both myself and my doctor believe that it's about 99.9% likely I do not have COVID. So I had to go there. It was weird, Chris. It was like a ghost town. The parking ramp, which usually you can't find a spot. There was like maybe 20 cars in it. When you go in, you had to go in through one door. And this is where it immediately hit me like, you can see how hard it is for this hospital to get up and running because everybody who came through had to get screened at the front door. They do the temperature. They take you through all the COVID kind of questions. It took maybe 10 or 15 minutes to get me and another couple through because we had to wait for escorts to come take us to the hospital. And now, again, this is a COVID designated hospital, so maybe there's more precautions at this one. But if you think about that health system, this is probably the primary hospital for them in terms of elective procedures. And it's completely, if not shut down, reduced to the escort told me they had done a few surgeries that day. It was the first day they had done non-COVID procedures in that hospital.
Yeah.
So that's just an anecdote of how hard this is, right? Everything from social distancing, which we've been reading more and more about, right? The need to space people out, just that. Yeah.
Yeah. The whole idea of waiting rooms, right? The whole idea of scheduling things tight, keeping your schedule so that you're pushing patients through. All of that whole thing is going to have to change. And to your point, Chris, thinking through multiple entrances, how to filter people in, how to approach testing, temperature taking, setting expectations. And, we're seeing that, hospital marketers are having a significant role in trying to communicate that to patient and patient families to also help them understand that, look, we understand that there may be some exceptions or situations that we need to work through with you. So cases of children in particular, right? And having multiple children and children wearing masks and how do you distance in those circumstances? So if you think about the fact that when we go to the grocery store, we're struggling with the little arrows, imagine, right?
Yeah.
Imagine that when you get into a large environment like a hospital. So it sounds pretty basic, but that's a pretty significant change and challenge right now.
Yeah. So just the logistics of moving people through we have heard firsthand slowing down the throughput of procedures, right? Okay. Then there's also the concern of PPE, still a concern. We hit this a couple weeks ago in terms of the guidelines that are out there. And one of the notable differences between CMS guidelines and the guidelines put up by AHA and ACS was around PPE, whereas the AHA, ACS guidelines are very clear. You should not reopen for procedures that are non-COVID unless you have an adequate supply of PPE. CMS was a little softer. It just said, essentially, PPE is important, right? But we continue to see stories about concerns about that.
Yep. Yeah, and I mean, PPE isn't obviously just for providers anymore. It's for families and patient families coming in and the multiple times that they may be doing that. I think the other thing that we're seeing and that we've talked about throughout this whole pandemic has been, how does your staff feel about PPE? Because as much as, and I would also like to say, who among us, at least on this side of healthcare, understood that masks and other, gowns and those sort of things were called PPE, and all of a sudden, that is
Right.
a word, that is an acronym that we're all pretty obsessed about, right? So, I think trying to reassure patients that we have adequate PPE is important. It's a limitation, but also, how does our staff feel about that? Because as we've seen, when our staff is out talking about their concerns, they are a very trusted voice, and we're seeing that across the country, actually, where perhaps staff are contradicting kind of the message we're putting out about the availability of PPE. So we've got to be aligned with stuff like that for sure.
Yeah, and we're seeing a lot of news stories driven by union activity and messaging, nurses in particular, the Twin Cities. There's been some stories about nurses concerned about PPE. And I think there was a story somewhere in nurses somewhere going on strike or protesting or something for that. And then there's also the challenge of supply chain,
Yep.
how you get this. We know that the way PPE has been handled just to deal with the crisis has been kind of a muddled mess, instead of having I might get political here, but instead of having a federal focused way to do this, it was kind of like you're all on your own, states competing against each other, driving up the price. It's been kind of insane. And so that's going to continue, especially when you think about the numbers of people we've been dealing with COVID are no good. They're too high, but they're nothing compared to the number of patients that need to be seen outside of COVID.
Right.
So if we expand the need for PPE to that non-COVID population, those shortages are going to become more pronounced.
Yeah, absolutely. Absolutely. And it's going to be top of mind for everybody.
Yeah. Yeah. So some other things, some other reasons why this has been a struggle, right? You now have to worry about families and visitors in a different way. We kind of touched on that a little bit before, but it's not easy, right?
No, for sure. I mean, communicating ahead of time, what those, what the changes and policies are. Again, making exceptions where exceptions are made. Think of elderly patients who might absolutely have to come in and need some additional support. Think about parents with children, and the fact that there might be multiple children besides a particular patient, and being sensitive to the fact that yes, you have to have a policy, but how do you help people understand it, and then navigate that if they have a unique circumstance.
Yeah, and it just, the list kind of goes on, and we don't need to belabor all of them, but we have touched on the challenges with pre-op, procedures, things that may need to be repeated, or how do you actually accomplish them, given all these other challenges, just to get people in for surgery. There's even an interesting story in Health Leaders Media that Chase can share about the challenge of schedulers, having enough of them, having them, prepared for the onslaught that hopefully will come. Let's talk a little bit about what all this means, and we can move on to some other challenges in general, because this is just the operational challenges, right?
Right.
For marketers and communicators, the first thing I would say is, if you can have somebody who's participating in that reopening committee, in those meetings, who's in there, hopefully shaping some of how this works, but at the very least, hearing firsthand what the challenges are, that's going to allow you to be much smarter about how you communicate and go to market, right?
For sure. I mean, having a seat at the table and being able to accurately really reflect what's going on in the operations is really going to be critical to getting patient trust. And, again, being at that table versus necessarily, I think you've called it before, the dog being wagged by 100 tails, right? Isn't that what you said?
Yes, that is it.
Yeah.
Well, and that is the reality that I think we're hearing from so many people is that chaos is probably a strong word, but it is not as smooth kind of thing. And it changes every day. And one of the things that related to this that we think is so important is, of course, marketers, hospital and health system marketers have always been kind of on the receiving end of irrational demands from physicians and service line leaders about marketing. We got to get our story out and all that. But we're hearing some really strong negative inputs from those folks now, like, why the heck are we not out there? And those folks not understanding that this is a complex situation. And so our recommendation to marketers is have a plan for how you're going about this. Articulate some key philosophies that drive that plan. Like, we'd rather be a day late, but be transparent about what the reality is versus a day early and cause more problems than we're solving. Those kind of things so that when somebody pops up, sends you an email or calls you and says, what the heck are we doing? Why are we now not out there promoting my toe jam surgery? You can say, because A, here's the plan. You're 32nd on the list because you're responsible for toe jam surgery. B, you're not even ready to see people. We're having to turn people away because of the situation in your small toe jam clinic. Whatever the case is, having something documented that articulates all this is really important to be effective, but also it gives you a bit of a shield. Absolutely.
Gives you a little bit of leadership cover, right? I mean, gives you the ability to kind of articulate where you're at and the alignment across the organization to the extent that you can get it. You bet.
Yeah. Yep. So another one that we've spent a lot of time talking about is patient fears. And I think there's two kinds of those. There is the fear of coming back to a hospital, of getting COVID there. I had to go into a COVID hospital yesterday. Because I'm in this business, I felt pretty good about it, but I have to tell you that I did not touch a thing. The only thing I touched was something like myself. I used my elbows for everything. I just was not touching a single thing in the hospital, right?
Did you have gloves? Did you have gloves on?
Well, what was interesting was at one point after the scan, I had to wait for my results, and the results are great. No cancer, no pulmonary embolism. So I got that going for me. But I had to wait for the doctor to call me in this little waiting cubicle. And there was a phone on the wall. And they're like, yeah, he's just going to call there. Just when the phone rings, just answer. I'm like, this public phone that everybody else can use. So I found gloves in the room and I was ready to answer with the gloves. And then he actually called me on my cell. Nice. So that's me. And we're pretty deep into this, Chris, but we know that people are very fearful of coming back in. So that's one thing. We spent a lot of time talking about that. We have a lot of research on it. Definitely go to thinkrevivehealth.com/COVID-19 to see our results there, because we keep exploring that. Let's spend a little bit more time talking about the financial fear. And that is related to what Paul Keckley was talking about, the loss of jobs, the loss of insurance. Even if people haven't lost their job or insurance, right? I saw an article today. I wish I could remember what it was from. It said, it's the 1980s again. Everybody is saving, and that's a problem for the economy. So just in general, not healthcare, the idea that we're all like, not trying to spend in case, right?
Yep. Bain did a recent study, May 4th through the 6th, where they found 79% of consumers are concerned about their finances. So when you take into consideration that even if somebody is employed, right, and you look at the out-of-pocket expenses that they're going to incur, and just, if you look at some of the common procedures, like 7 common procedures from a study we found, that's about $1,800 in out-of-pocket for 7 common elective surgeries. Combine that with the fact that people are already concerned about their finances. And then another study that we found from a care credit and financing company suggested that 3/5 of respondents said that out-of-pocket medical bills are not in their top 5 priority of their household expenses, right? So the financial concerns are likely to inhibit people, even who are commercially insured, for those types of services that they're not necessarily feeling super pressed about receiving, right? And again, it's going to depend on a person and their attitude, but spending is tight.
So people still talk about healthcare as kind of immune to the economy. It's immune to recessions and things like that. There's an economic term from it, and I can't remember. It's something about fungible or whatever. Maybe Chris, you remember, or Chase, you remember it. But we learned in the Great Recession in 2008, 2009, it actually, if it's a severe enough situation, it doesn't hold true. So people at that time too kind of got in the same bunker mentality. Both, you had huge losses of jobs. You had people that were really concerned, and so not spending their money, again, kind of the cliche of cutting their pills in half, right? So I'm going to stretch my prescription an extra month. I'm not going to refill it. I'm not going to go back to the doctor. Certainly not going to get a procedure unless it's life-threatening. We are now seeing that emerge as the new financial threat, right? The existing one is not getting people in the first place because we couldn't. Now, when we can, will we be able to get them back in, not just from fear of COVID, but from these financial fears?
Right, exactly. And I think that same initial article that you kicked off our conversation with today talked about the fact that, the $3.6 trillion healthcare market is 18% of our gross domestic product, right? And we're seeing that shrink significantly. So if there's any doubt about the amount of spending that goes on in healthcare, both from consumers as well as other payers, that's it. And we're going to see that shrink based on what we're talking about, right?
Yeah. And so, we've been conveying this to our clients as part of their messaging. You've got to allow for that potential. So even for people that were scheduled and that were postponed or canceled, and this is part of your patient retention effort, there's going to be people who you try to get back on the schedule and they say, I don't have insurance anymore, or I'm fearful. And being able to provide messaging and content to help them through that with whatever means is possible, pointing them to resources, whatever it takes, that's really important. And then again, staying aligned with leadership, staying aligned with finance and operations to make sure marketing reflects the priorities of the organization. I mean, that gets into payer mix, Chris, which we know is kind of a bit of a third rail, but you have to be thinking about that because a lot of folks are going to be moving to Medicaid. They're going to be moving to self-pay. And as we said at the top of the show, you just can't survive on those payer with that level of payer mix, right? You've got to keep that commercial as much as you can, and marketing needs to support that as much as it can.
Yeah, I mean, we also saw in a lot of the earnings calls from the for-profit sectors come out. There's now more discussion around payer mix and how the uncertainties around payer mix are going to be a key factors in their forecast. Again, we knew that was coming. I think, the way that we can think about it as marketers is payer mix represents a person, right? So when you're thinking about how you're aligning with the organization to kind of meet the business objectives, bring that outside in perspective about those consumer concerns. And how can we really use this as a time to engage patients, to have conversations around those financial questions that perhaps we've been a little bit reluctant to do. Again, I'm not suggesting that's a place that marketing owns the message, but I think, marketing does own the consumer lens in a system. So how can you make sure that you're bringing those ideas to the organization to help address that, both at a patient perspective, but also recognizing the larger impact for the system when it comes to the overall payer mix of the organization.
All right. Well, that was a great conversation, as I knew it would be. We're right up against time. So I think let's wrap right there, Chris. Thanks so much for joining.
Thanks for having me.
Yeah. And Chase, as always, sir, thank you.
Absolutely. Enjoyed it.
If you would like us to cover something, just let us know. Put it right there in the chat channel or email me at cab@thinkrevivehealth.com. Thanks to Chris and Chase for joining. Tomorrow we have Jeff Spear back as a guest host, and Ben Fuqua will be joining him. He's the head of our research and analytics department at Revive Health. So we're going to be talking about consumer targeting, which obviously would be super important as we try to gain volume in this really important time. Remember to visit thinkrevivehealth.com/COVID-19 for a recording of today's episode. Subscribe to iTunes and share this with anybody you think would find benefit. And as always, keep up the good work. What you're doing is super important. Everybody's appreciating what you're doing as a hospital, health system, marketer, communicator, and we're going to be there with you as long as this crisis is there each day. So thanks for joining us today, and we will see you tomorrow.
Thank you.